Fantastic. So here we are. So let me do the introduction so you know where we are coming from. Thank you everyone for attending the 6th BritBanglaCovid public meeting. Since we had the first lockdown on, I'm not sure if you remember, on 26th of March 2020. That's pretty much just over a year and 2 days ago. And I'm Ripan Ray, your host for today, and also storyteller during the pandemic from the perspective of British Bengalis. If you want to have a look at the work of BritBanglaCovid, just type BritBanglaCovid.com. And moving forward, really, apart from telling stories, BritBanglaCovid organized various campaigns in order to educate minority communities and the challenges minorities communities have actually faced during lockdown. And to highlight some of the issues, we organized public events such as what we have today. We've organized topics around health and social care, housing, amongst many things. But today's one, it's looking at from the perspective of vaccinating all communities, including those who are undocumented, because BritBanglaCovid believes that to eradicate the virus systematically, you can't just hide behind bushes and ignore communities who are undocumented. So as part of the campaign to encourage undocumented communities to register with the GP, we produced a leaflet in 13 different languages, which you can also find on BritBanglaCovid's website, and later on I can happily share. And I also work with worlds of doctors of the world really to kind of get that on the way, and various migrant centers have already started to use it, especially Hackney Migrant Center and other places. So, but today it's really is about identifying the role of one of the pillars of the welfare state, or the state anyway, and that is NHS, and unfold the role of the NHS and the various strands of the NHS, i.e. GP, inpatient, outpatients, and then the role of local authorities and the third sectors to properly understand how the whole system as a whole works, so at least undocumented migrants don't feel the nervousness that they had, because I already had 3 queries from representatives of undocumented migrants. So it'd be useful now to demystify the health sector for the benefit of undocumented migrants. So I know we have a number of speakers. So first speaker would be Nuru Chaudhary, who will be giving us an insight into it. And then of course we'll have others. So let me give the floor to Nurur.
Thank you, Ripad. Good afternoon, everyone. My name is Nuru Chaudhary. I'm one of the senior healthcare scientists who work for Barts Health NHS Trust at the Royal London Hospital Intensive Care. First of all, I just want to make everyone aware that I am participating in this event not as a representative of my organization or the hospital, with my personal capacity. It's a privilege to be able to speak to everyone. But what I would be doing, sharing some information that I have been able to explore. When I first spoke to Ripan, I remember, Ripan was telling me that anyone can register with GP surgery, for example. At that point, I wasn't sure that was the case. So I must reflect that on that particular area, I wasn't very much aware of the rules and procedures. And from that point, I realized the importance of us sharing this information within the community, especially in relation to members in the community who might be undocumented. I was talking to one of my colleagues today, and then we were talking about that issue. And one of my colleagues mentioned about illegal immigrants. And I reminded my colleagues that please be aware that not everyone would be comfortable with the term illegal immigrants, because an immigrant who might be undocumented doesn't necessarily mean that the person is illegal. So again, there could be a lot of misunderstanding, misinformation, or confusion around the issue of undocumented migrant. So I believe that we, as the organizer of this event, have taken this approach, which is based on kind of a human approach to recognize that everyone needs to be vaccinated to deal with the challenges in relation to COVID-19. So first of all, let me talk about registering GP. The panel members, I'm sure we are all aware now that anyone can register with GP. So my focus would be the word anyone. If you visit, or anyone visits nhs.uk website, it does say how to register with a GP surgery. And it has been made very clear that anyone in England can register with a GP surgery. So I would share that information with the community, that be aware of the wording. It says anyone. And it does also say that you do not need any proof of address, immigration status, ID, or NHS number. So that's very important to give people that confidence that we should be very proud of being a state where the state has taken that human approach, that anyone living in this country, regardless of their immigration status or the status in relation to their address or identification, but they are being given access and given the right to register with the GP. So that's my first point of awareness, that anyone can register, and there would be fear within the community, especially the ones without the proper documentation. They may have the fear that when I go to register, I would probably be asked for this documentation, and this is what I personally used to think that was the case. So it's not the case. However, there are some relevant information I think we are obliged to focus on and share within the community, that there might be reasons why a GP surgery may refuse to register. But this is not because of someone's immigration status. It could be because they're not taking any more patients, they're full, or there might be other rules or procedures relating to the boundary of the area. And maybe there are some other issues, again, not relating to the status of the person. So when we talk about undocumented migrant, our focus is on documentation. So this is not a valid reason for a GP to refuse someone. There are a few other areas that I would like to share some information. Again, while we are emphasizing on the fact that everyone entitled to have the vaccine, everyone should have the vaccine. But again, personally, I would be mindful that anyone can register. So we promote the entitlement that anyone can register with GP. However, I think we are also under a duty to make people aware that just because one can register with a GP without proper documentation, it doesn't actually give that individual or individuals the right to have all the NHS treatment. I think we have still a duty to clarify that. Otherwise, people might get confused. So I checked with gov.uk website in relation to COVID-19 migrant health guide. It made it very clear that there will be no charges for coronavirus testing, treatment, and vaccination. So when it comes to COVID-19 testing or treatment or vaccination, there will be no charge. However, there would be charges for some treatment. If one needing treatment in hospital, nothing to do with COVID-19, then there might be charges. So members need to be aware of that. Also, it's been made very clear by the government that no immigration checks are needed for the people needing the test, treatment, or vaccination. So to give people the confidence that if someone needing the test or need treatment or vaccination, there will be no need for the checks, especially the immigration status check. So that's quite important. But again, let me go back to the fact that there is an important term we need to, in my opinion, be aware, and then we need to share with members who are we working with, especially undocumented migrants, that there are some rules relating to ordinary resident, the term ordinary resident. So people who are not legally called ordinary resident may not be entitled for certain treatment, as I said before, in the hospital. But again, our focus is not all other treatments that one may require. So obviously, we are not an expert on this, and we wouldn't be advising people what they need to do if they need treatment for any other disease conditions or any other illness. But again, our campaign is to make sure that everyone can get the vaccination, regardless of their immigration status. So again, going back to the same entitlement, that regardless of their immigration status, anyone can register with GP and get the vaccination. Again, if someone have conditions relating to COVID-19, they are also entitled to have treatment in hospital. So this is something quite important. So COVID-19 related hospital treatment is also free. Testing is free, vaccination is free, and the treatment is free. So that's all I would like to share. And one more thing maybe, I looked at the form. It doesn't have to be a paper form. The forms are online. People are being discouraged to not to visit, being told not to visit GP surgery, to register themselves. So if someone goes to the website, a form called GMS1 for a registration form, the form is straightforward, but again, on that form, it says when someone agreeing with the conditions of the form, it says that I understand that I may need to pay for NHS treatment outside the GP practice. So again, we need to give people the confidence that them signing in their box would not put them in a disadvantaged position in terms of COVID-19. So this is something on the form, it appears that the tick box. Also, there's another area, again, it reminds that in the UK, you may have to pay for NHS treatment outside your GP practice. So if someone going to register with GP, and if they see there is a box they need to tick, they may have the fear that by ticking that box, I'm probably committing to make the payment towards my whatever treatment. But I think what we can help with those members in the community that anything to do with COVID-19 would not be chargeable. So that's my understanding. I'm not an advisor, I'm not giving advice, but this is something that as a professional as well as a member of the community, I now understand, and I'm sharing this information with members in the community, and will be campaigning for that. Thank you, Ripon.
You've said it very beautifully, and yes, we need to campaign for exactly just that. So thank you for saying this, Nurur. Now, Natasha, I know you also have other things to talk about, especially when it comes to myth busting. So clearly we want to kind of demystify things and make things clearer from your perspective of a different dimension to the NHS, and especially when it comes to information or misinformation. What else would you like to add to that?
Thanks, Ripon. So I know you weren't keen on me sharing slides, but would you mind giving me permission? Because there's a couple of ones that I could share usefully. Is that all right?
Go ahead, please do.
Okay. So
if I can.
If you can enable me, then
yeah.
that'd be cool. If not, I can just drop the links in the chat.
Yep, I made you into host. Go ahead, change host. Yep, go ahead. You've taken the power away from me.
Can you see this?
Yes, I can.
Okay, cool. So hi everyone. So I'm Natasha Howard. So I'm Knowledge and Library Services Manager at NELF, North East London NHS Foundation Trust. We provide mental health and community health services in North East London, Essex, Kent and Barnet. I'm also a strategic ambassador for our Trust's ethnic minority staff network. So like Nuru, I'm also speaking in a personal capacity. I'm not representing the Trust this afternoon. So here's a picture of me getting my first dose of the AstraZeneca vaccine a few weeks ago. And this was taken as part of our efforts to encourage all of our colleagues to take the vaccine. So I want to be clear here, I'm not a clinician, I'm not a qualified healthcare professional, I am a librarian, I'm a health knowledge specialist, so I can't give you clinical information or health advice, but what I'd like to do today is share some basic principles to help us identify good, reliable information and a few trusted sources of COVID and vaccine related information. So the idea is that I can signpost people and help you and people in your networks and your communities to make informed choices about the vaccine. So as we know, the pandemic has led to a proliferation of health news stories, both on mainstream media, social media, in our WhatsApp groups and things. It's everywhere. And suddenly every other person thinks they're an expert epidemiologist or virologist or whatever. And this explosion of information we refer to as an infodemic. Now, as we realize, not all of the information that's in circulation is reliable. Some of it's what I usually use the short fake news. It might be myths, it might be rumors. And the terms we'd use in our area, if we, in the discipline of information literacy, we would talk about misinformation, disinformation, and malinformation. They mean slightly different things. So misinformation is like unintentional mistakes if you get some numbers wrong or if you share something that you think is true but actually it isn't. Disinformation is where there might be deliberately created conspiracy theories and rumors. And then malinformation is where people really have malign intent and they're doing stuff with the intention of harming people. So we know that minority groups are being deliberately targeted with fake news about the vaccine. And we know that these fake news messages are tailored to concerns relating to particular groups. So it's quite a sophisticated, nasty campaign, really. So for example, Jewish people and Muslim people are being targeted with fake news saying the vaccine contains pork products. Different Black communities are being targeted with fake news saying the vaccine affects fertility. And one thing to bear in mind is these fake messages have not just come out of nowhere, they are linked back to historical wrongs that have been perpetrated against different communities in the past and the not too distant past as well. So when some people talk about communities being hesitant about taking the vaccine, to me, I think this is quite understandable really, because they're being targeted by bad actors. Then there's the historical stuff. And then we have this background of general racism, health inequalities, hostile environment in this country. So I can't speak to the issues around accessing the vaccine and things, and thankfully Nurur has covered that all off for us already. But what I'd like to do is give you some tips on spotting fake health news and some links to some reliable sources of information. So once people are in the position where they are getting healthcare, they can make an informed decision about whether they want to take the vaccine or not. So if I just go forward, hopefully. My slides will advance. There we go. Okay, so this comes from the World Health Organization. I can drop the link in the chat afterwards. And these are some of their top tips for navigating the infodemic. And they're giving you pointers for what you should do. And this really applies to any kind of news. It's not just health news. So some good things to think about if you're thinking about trying to improve your information, your media literacy. So first thing, assess the source. See about where the information is coming from. If you get it from friends and family, where did they get it from? Who gave it to them? You need to look at headlines because sometimes I know Ripon didn't want me to be political, so I try not to, but this happens a lot at the moment, doesn't it? You see a headline, it says something absolutely outrageous, but when you read the story, it's not quite what the headline was actually making out. We've then got to look at the author, because sometimes people, they might not even exist really, or they might have given themselves qualifications they don't have. So we need to be aware of that. We need to look at the date. One naughty trick people will do is they'll post a photo that's years old, but they'll pretend it happened yesterday and it was some dreadful thing in a different country or whatever. We need to look at supporting evidence. So one thing I got through on a WhatsApp group of actually NHS colleagues. Somebody sent through a thing that was purporting to be a link to a government site with info about the vaccine. So they had the government logo at the top of the WhatsApp message and then all this text. And I looked at the text and I thought, this doesn't look quite right. So I clicked on the link and the link did take me to the gov site, but the info that was on there didn't match what was in the WhatsApp message. So that was a really naughty trick because putting that government logo at the top makes it look legitimate, and actually when you started looking at the two bits, they didn't match up. So you have to be really careful. And I did push back on that person and said, don't share this, it's, you know, it's junk. So the next thing we need to do is check our biases, because what we think and what we believe, consciously or unconsciously, is going to affect whether we accept what someone tells us as being true or not. So one of my things is that I have a predisposition, I'm quite positively disposed towards certain regional accents. And I find if somebody with a certain regional accent is talking to me, I automatically think they're a good person. So I'm going to believe what they say. So I need to be aware of that. And that can happen, you know, in our different religious groups, communities, particular family members who we're fond of or whatever. So we need to be aware of that. And then the last thing to do is turn to fact checkers. So I'm going to give you a couple of sites, or a few sites, where we can go to find myth-busting information. And if you're not sure, really, you need to check with health professionals as well. So if I just go on. Okay, so that World Health Organization infographic that I showed you is, as far as I know, it's only available in English. I wanted to show you this one because it's basically the same, pretty much the same, but it comes from IFLA, the International Federation of Library Associations. And why I like this one is because it's available in loads of different languages. So that link there will take you to the page where you can download the different versions in different languages. So that might be useful for particular people. I'm just looking at the time. Let's perhaps not dwell on this unless anyone's got any particular ones they want to ask me about. I don't want to put ideas in people's minds. Even on Friday, I thought I knew all the myths that were circulating, but even on Friday, a colleague messaged me with something that a parent was concerned about, and just anyway. So there are a number of really good places for finding information about COVID generally, and the vaccine as well. And I can, as I say, I can drop these into the chat so people can investigate in their own time. We really like this BSI guide to vaccinations for COVID-19. It's a really comprehensive document from the British Society of Immunology aimed at the public, but it covers so many questions, really comprehensive. There's some lovely videos from colleagues in East London and in London more widely, talking about the vaccination in different community languages, and also about vaccination efforts in different community centres and settings and things. So for people who are find reading less accessible, some of those videos might be useful. And there's lots of languages on that NHS London link there as well. So my colleagues at Health Education England, which is part of the NHS, have put together a page of trusted resources for the public there. That's the one at the bottom. Now that covers all aspects of COVID, like long COVID. It's got accessible formats of information for people with learning disabilities, sign language, different languages, stuff about long COVID as well, and the vaccines in there too. So that's a really useful place. And because the resources have been collated by knowledge specialists, they're all good. They can all be trusted. A few more here. I think my favorite is Full Fact. I'm not sure if people have heard of that. It's an independent organization based in the UK, and they fact check news stories. They don't just do health, so it's worth a look if you for any kind of stories you might want to check if they're true or not. And you can also report things. So if you see a story in a paper that doesn't look quite right, you can ask them to check up on it for you, and they'll add it to the site. There's another crowdsourced, I think it's crowdsourced guide up there that a colleague recommended. And then this organization called NewsGuard, they have a special page where they're outlining people who they're calling their social media misinformation super spreaders. And you can see they've got this chart of all the myths that are currently spreading around the globe. And then they delve into those and explain why they're not true. And sometimes there's a bit of a story behind. Things might not be completely untrue. There might be a little kernel of truth that led to why a myth has become gained traction. And then at the bottom there's a documentary, The Race for the Vaccine. So one of my medical colleagues recommended this. I haven't actually watched it myself, but he said for people who think that the vaccine's been produced too quickly and corners have been cut and things, actually they started filming this right when they started making the vaccine, which was way earlier than people realize. I think if you're in public and you're not in the know, it sort of seems it happens incredibly quickly and suddenly they're vaccinating people. Actually, it started a long time before, and all the procedures have been done properly. So that talks to the scientists and explains all that. And then, yeah, just lastly, this is another infographic from the World Health Organization. What they're saying is we need to try and flatten the infodemic curve. So we need to, when people send us stuff that looks a bit off, we need to have a look at it. Don't send it on unless you're sure that it's good quality stuff. And that way we can stop the spread of this misinformation. And then people can make their own informed decisions based on quality info about what they want to do with regards to vaccine and everything else. I'm happy to take questions now or carry on, Rip. And I think you're probably looking at the time, aren't you? Sorry. Thanks. I'll come off share.
Yeah, I think what we could do actually, we can always easily come back a bit later, partly because the crowd is small, so which is great, which means we can be more personal. However, I mean, yeah, there'll be two strands to this anyway, overall, and then what needs to be done in practice. So we'll come back for sure, Natasha. But if anyone wants to ask questions to Natasha, please go ahead. Feel free to do so. Any questions for Natasha? Fine. Or have I killed it? Let me know if I have. But yeah, what I could do, I can also send an email to everyone with attachments of Natasha's anyway, and also her email if you are okay about it.
Fine.
Yeah.
I can share my work email and my Twitter. It's actually on the last slide there. So yeah, that's fine. If people want to ask me stuff offline, that's fine.
I think Naseem's got a question. Go ahead, throw away or far away.
Natasha, we have encountered a lot of mosque or various different fake scholars giving a lot of religious output onto this. How do you tackle that? Because that's a very, very emotional, sensitive, and obviously you yourself may not be very religious, but you rely on people that knows this really well. How do you kind of combat that, if there's any?
Yeah, so I think I'm personally myself, I haven't had much direct dealings with our local faith leaders. Other colleagues in our ethnic minority network leadership team have been liaising with local faith leaders about this, because I'm sort of talking generally about awareness in the public, but as you can imagine, even amongst NHS staff, there is some hesitancy and there's some concern and things. So what we have done is there's like a couple of local networks that they've tapped into and spoken to the faith leaders and done some awareness raising. And I think most people have come on board, but I think where people aren't sure, it's the same as what I was saying just now, trying to encourage people not to spread misinformation. Even if you're against the vaccine and you don't think people should have it, that's your decision, but please don't spread stuff that's not true. And I think what we found within the trust is that most of the faith groups they've managed to cover off by speaking to faith leaders or speaking to them individually and things, and dealing with their specific concerns that they had. But yeah, it is tricky, isn't there? Because there's some faith leaders have a lot of personality, a lot of traction, a lot of followers, and if things aren't happening in the open, it's hard to know what's going on. I remember reading about this guy who was selling bottles of water and like red string or something, and people were paying him £90 a time, and this was to protect them from COVID and stuff. And and that's just one person who's been caught. Who knows what else is being said, especially as all churches are online, or worship is online at the moment. So yeah, sorry, I'm kind of fudging it, Naseem, but I think we've found the value of the personal conversations, or like one-to-one or one-to-two conversations, and trying to deal with people's individual queries, because then sometimes you can change people's minds, and some people you aren't going to change their minds. I know there's some communities believe this is the end of days, and the vaccine is the mark of the beast and stuff, and there's not a lot you can really say if that's how people are, if that's how people feel. Yeah.
Any more questions for Natasha? Rachel, floor is yours. Go and tell us about the input from local authorities and what local authorities can do in the context of undocumented migrants.
Thank you, Ripon, and thank you for putting this great session together. I really appreciate it, and I'm learning loads. I really like Natasha's slide about the, how you tune out the bad information. I'm going to start doing that a bit more, I think, in my life. So my name's Rachel Blake. I'm a local councillor, I'm deputy mayor, and I'm lead member for adults health and wellbeing at the London Borough of Tower Hamlets. As we know, it's been a really difficult time for the whole community, but three things have become really clear: the scale of our health inequalities and how damaging they are for the whole community, that our community is strong, demonstrated by that within hours, community centres were organising community kitchens and neighbours were reaching out to each other, and that the third thing is we don't want these health inequalities. People came together and they said, I want to reach out, I want to be part of a community that doesn't have health inequalities. And I really think that we have to kind of take that with us. So Ripon's given me quite a clear brief, which I will try to stick to. But when I was talking to our public health team about the remarks for this webinar, they said to me, because some of them are clinicians, they did say the event is stated as part of a wider campaign to eradicate COVID-19 virus, but we should note that the vaccination programme will unfortunately not eradicate the virus, but the aim is to achieve a level of control such that normal activities can resume. So as others have said, I'm not a clinician, I'm a politician, and so I wanted to sort of make that clear, because I have taken some advice and talk through some of this with public health colleagues. So Ripon's asked me to talk about the council's role in this. I mean, our role is really quite broad, ranging from our convening and influencing power to our commissioning role within the public health team. I'm really proud of the work that we've done so far, but I know that there's a lot more to do. So in terms of the responsibilities of a council in a pandemic to protect vulnerable communities, we are running a huge organisation and carrying on with our statutory duties, protecting vulnerable children, vulnerable adults, and keeping our areas safe and clean, as such in terms of our core functions. But we were also doing things like we set up a mutual aid PPE hubs so that different providers who might need PPE could support each other through the process. We had to reorganise our domiciliary care and establish mechanisms for making sure that domiciliary care was still sustainable and up and running. And our Director of Public Health is a formal role, and he or she can convene and advise our approach overall. But overall, regarding this, our role is to clearly advocate for a public health approach to vaccination, which must be inclusive of everyone in order to be effective. Second thing Ripon asked me to talk about is what forms of challenges people face by local authorities in dealing with the pandemic. I mean, like any organisation, we've had staffing has been a significant issue. We've had people unwell, and they're also looking after people unwell. And of course, many of our services are on the front line. So people need to protect themselves and their families and communities by self-isolating when they've had a positive test. And some of our roles people can carry on when they're self-isolating because they might be desk-based, but self-isolation for some forms of social work and obviously domiciliary care has a really significant consequence for the organisation. And also as an anchor organisation, an organisation that people really turned to during the pandemic, we had a lot of new things to look to do. So how do we get shopping to people if they can't leave the house and they don't have friends that they can draw on? We needed to provide additional public health advice to schools, to businesses, to really integrate our environmental health powers with our public health powers and provide public health guidelines to faith organisations as well. Specifically regarding the vaccination of undocumented migrants, I mean, one of the things that we have done is to emphasise some of the messages that Nuru and Natasha have talked about previously, to be really clear that the vaccine is being offered to undocumented people in the UK, but because you have to be registered with a GP to offer the vaccine, we're having to overcome those barriers. So there is now really clear guidance issued through Doctors of the World as well, to make this clear that everyone is entitled to register with a GP surgery, receive free primary care regardless of immigration status. And practices, it's also been really clear in this guidance that practices should continue to register new patients. And so part of our role is really emphasising that. But we know from the Doctors of the World research that I've posted in the chat that it can still be difficult to register. So nearly 20% of attempted registrations from the Doctors of the World research were actually refused. Many of our GP surgeries in Tower Hamlets have signed up to the Safe Surgeries initiative for undocumented migrants, which does help ensure access. In terms of our specific role to encourage vaccination, there's several things that we've done already, and there's several things that we plan to do. So this isn't specific to undocumented migrants, but I did want to mention it because it speaks to some of Natasha's points about understanding the infodemic and how you support people to do that. We've set up a COVID Community Champions Network. They meet online every Tuesday night. They're a group of really committed citizens who want to know information and then to feed back to us. This is also spun off into a Friday morning kind of cuppa session, they call it, where it's a chance for people to kind of talk with friends and talk through some of the issues that they're facing during COVID. So it's not specific to undocumented migrants, but it is something that we're doing to raise awareness so people are really clear about the facts and can continue to share those facts. So in terms of our specific work around undocumented migrants, we're supporting advocacy by Doctors of the World and other third sector partners to support GP registration. We have an engagement, and we're doing engagement and outreach in partnership with charities using interpretation where needed, social media and live webinar formats. We're promoting the Safe Surgeries initiative through our partners' communications channels and promotion of the East London online registration platform. We've also been working with the Asylum Seekers Accommodation in Tower Hamlets to register people and arrange vaccination clinics directly. So we're doing clinics directly within where people are actually living. We've done preparation work now with a range of outreach teams, and then we'll be able to, in order that we can carry on and do those clinics ourselves. We've commissioned Doctors of the World to talk about further clinics in order that we can run clinics in places where we know undocumented migrants might be, so that we're taking vaccines to that area. And also, and this is all possible through through our public health team. Going forward, our qualitative insight suggests that we do need to do more to enable access who are too fearful to register with a GP, and that's something that's consistently coming through, so that will form our work going forward. We're working with our partners to open up access to clinics for those who won't follow through on GP registration. We're working on a partnership approach between all of the health providers and third sector organisations so that we can really work together. And we're pursuing this idea of clinics in places where we think we might be able to reach the most undocumented migrants. And then we'll obviously be following that up and carrying on considering our options going forward. So those are just some of the things that we're doing. And yeah, I'm really happy to take questions and hear ideas about what more we might be able to do.
Looks like, oh, thank you, Rachel. You gave a very good insight, I must say. So Ron, go ahead, Ron. And then
thank you so much, Rachel. I wanted to ask you a question. You mentioned about the undocumented migrant who might have a fear or could be fearful to approach a GP surgery to have it registered. I had this concern because obviously people who are not documented, they would be living with fear of, they would be trying to avoid government organizations, or organizations may have their link with the government, or somehow Home Office or other law enforcement agencies. So to be practical, I wanted to find out, as you mentioned that you are in collaboration with local GP surgeries, and then you mentioned 20% of attempt been failed, or whatever reason those 20% attempt failed or not been succeeded. So what can be done, or what is being done to address the 20%? If 20% people can't get registered, or attempts been failed, so we don't know how many undocumented migrants we have in the community. First of all, we don't know the numbers, and amongst those who are making these attempts, if 20% not being able to register, then that's quite a challenge. What question that came in my mind, that if I know undocumented migrant, if I encourage the person to apply online, the first thing they would see, they ask for an address. So they may not have an address. If they can give an address of their uncle or relative or whatever, that person may have a fear that just in case if information being shared with Home Office or other government agencies, then that might have a consequence of giving their address. So how we can actually give that confidence? Is there any way we can actually protect those people? What is that, as a local authority, do you have the legal power or some kind of authority to ensure that these data will be protected? So if we can't give the assurance to those undocumented people, they would have the fear and may not actually come forward. Sorry, my question was too long, but this is my concern, and I'm sure it's a shared concern among undocumented.
Rachel.
That's okay. Shall we have Ron, and then I can do both?
Yeah, sure.
Unfortunately, Nurur has stolen my thunder, because I was going to ask the same question. Because in Bristol, where I live, the local authorities have taken initiative to work with community leaders to target refugee and asylum seekers. And they set up pop-up clinics, including those which work with refugees. But the key issue from our perspective is the reality of the hostile environment. And the reluctance of many migrants, for good reason, to come forward for the COVID vaccine because of their concern that information will be shared with the Home Office. So the question is, what is Lambeth doing? Excuse me, what is, not Lambeth, excuse me, forgot the name of the council.
Hamlets?
Yeah, she's from Hamlets, yes.
Tower Hamlets, sorry. What is Tower Hamlets doing to assure migrants, undocumented migrants, that if they do come forward, that information would be kept confidential and not shared with the Home Office or any other government agency?
Hi, sorry, I'm just going to keep the camera off. All my sons in the room. You understand. So in terms of, I just wanted to be really clear about the 20%. That's national information that the doctor that research that Doctors of the World did. We've got Natasha here, so she'll want to make me to be really clear about the exact about the source of the information, and I put it in the chat. So that's not a specifically local figure. I wanted to make that clear. So that's an estimate. In terms of what I think we can do is about encouraging, is that thing in terms of vaccination, it's those clinics that we've talked about setting up so that people can get, if there is a real fear, that we can do the clinics where people are already, if they are not going to register. And then with the registration, I think it's about the safe surgeries, the Safe Surgeries Initiative, and really promoting that Safe Surgeries Initiative.
I think Moslem has something to ask. Moslem?
Hi, Rachel. In regards to the government's announcement of giving vaccination to the undocumented migrants, I mean, I was involved at the last meeting with RIP. The following day, there was a newspaper article. But after that, I found that a lot of GPs didn't have the information that it was possible. Has all the information been given across the country to all the GPs? And the other thing is, people in public eye, so councillors, mayors, people in politics, why are they so reluctant to come out in public and say that this is the situation? We need to get every single person vaccinated, and everybody has the right to be registered with a GP.
Okay, in terms of the first question, I think that's more of a question for national government. That's certainly a message that we, in terms of public health, we are advocating as a public health authority for an inclusive vaccine program, because that's how everybody is safe. So I think at a local level we will be reinforcing that message. But in terms of your specific question of has that information gone to everybody, I think that's we need to check on that, because it's something that we at a local level, I think Natasha's saying, kind of nodding that would be the right, that's right, that we need to reinforce the message. And in terms of why aren't we saying more about it, I mean, I think that we are saying quite a lot about it in terms of reaching out to our community clinic approach into Hamlets is something that we're really proud of, to make sure that we're reaching the whole community.
Any more questions to Rachel?
I could just come in there quickly, Ripon, and say, yeah, I think there is always something about messages having to be repeated and that. So I think what I'm going to do is next week, we've got some communication channels into local GP networks and stuff. I'm just going to make sure I share that stuff with them in case there's anybody who's missed it, the first times they've been told. Yeah. There's
just thinking about it, how kind of North East London partnerships and the NHS can work together with the council. There are an awful lot of networks that we have where we can just keep pushing the message out, and I think we can definitely work together on how we can do that. And actually, I was just earlier looking on the Safer Surgeries website, and they don't have a list of the practices that have signed up. But I'm sure if you have signed up, you would want to celebrate it. So there's no reason why we couldn't find out which of the local surgeries into Hamlets and in East London have actually signed up, so that we can celebrate that. It might just be that it's difficult for them to do that on the Doctors of the World website, but I think that's something that we could do.
Anything else?
Ripon, yeah, I just want to say thank you, Rachel, for that. But I really think, I mean, looking at Bristol, we've been trying to get as much vaccination done for, especially the vulnerable. The two categories we work with the homeless as well as the, through that homeless, we've come across a lot of undocumented migrants when we've been working on the streets with the homeless people. And those are the most vulnerable people in our society, as much as, our elders, our elderly. And those are the people that need, but coming out in public, even we're afraid to come out public and say that, yeah, we are trying to support these undocumented migrants, because we're not getting that support from, people, like I said, the councillors, people in authority coming out in public, so we can then proudly say publicly, because it seems to be a mixed messaging, and that's the reason those people are afraid to come forward to get their vaccination. And 20%, if God forbid, don't turn up to the doctors or sign up with the GP and get vaccinated. That's around, I mean, Rachel would say the figures of undocumented migrants, everybody's saying is 1 million plus people out there. That's 200,000 people. That's going to be a huge number of people not being vaccinated.
Which is why I think this partnership approach, and sorry, Moslek, I can't quite see who your organisations are on your thing, but you say you're from Bristol, you're in Bristol, but that's why I think that a partnership approach where we're working with primary care networks, doing community clinics. So in Hamlets, we had a community clinic at East London Mosque last week, and we had one a few weeks before. We're trying to get a regular one into one of our community centres. So it's going to the places where people are, and also some of the, we've done vaccinating actually in hostels, which I think it really does, it's taking the vaccine to people.
Yeah, so my organization is called UK Curry Connect, even though we represent the skill shortage within the hospitality sector. We work very closely as charities that we support. So the hospitality sector, a lot of restaurants support charities like homeless charities, plastic pollution charities. With COVID, we don't have issues with the skill shortage, and we're not promoting younger people joining our industry. We're not kind of training anybody because everything's closed. We've been kind of working very hard on the charity sector and especially the homeless sector, because they've been affected by COVID very much. So it's UK Curry Connect. You can find us online, where we're basically a charity, a non-profit organization.
Well, thank you, Moslek, and thank you, Rachel. I know the next speaker is Naseem, isn't it? So Naseem, you can say a bit more about it, in a sense of like what are you seeing on a grassroots level, and what do you think needs to be done about it? So go on, Naseem.
Thank you, Rifon, for inviting me and giving this opportunity, and a very, very well, audiences we have today. And I've been listening, and I think, I am not going to be far off echoing very similar things what my previous speakers just said. So one thing I was given tasked to talk about, the homeless and undocumented migrant. Ripon has kindly put a list of questions that I've been trying to figure out how to present it in one go. One thing I'll start with slowly, a bit of homeless first, because I think, that's where my background is. Again, similar to what Nuru said, I am in my personal capacity. I'm a former trustee and the founder for Feed the Homeless, but I am here with a number of other organizations that I kind of work, and the knowledge that I gained for that reason. So homeless, I'm sure everybody knows there's two sides to it. One is visible homeless, one is invisible homeless, hidden homeless. Visible homeless is what we see in the newspapers, what we see on the media, people living on the street, they're called rough sleepers. And the hidden homeless is where we don't get to see them, but they actually move around a lot. They're called silver surfers, temporary accommodation, hostels. So these are hidden homelesses. Generally, they have a lot of families. Generally, they have quite vulnerable, and they have a lot of various background and reasons for them being homeless. And that hidden homeless is actually 95% of the homeless numbers that we normally count. So when people say, 30,000, 50,000, 70,000, and you go out in city center, you probably can count 300, 400. It doesn't make sense, because actually, the actual bigger chunk of the homeless, you can't see them in front of you. So I think that's one thing that I'm learning as I go along. A lot of people are skeptical about homeless, but the reality is, it is real, and it is, on that stage. Obviously, when we talk about vulnerable migrant or undocumented migrant, as soon as they enter into that category as a refugee or as overstay or various different other, unique stories that individually they have, they automatically become homeless. So, from day one, they are homeless. And one of the reasons is because they are not allowed to work. So if they're not allowed to work, they can't rent a place, they can't really have a home, they can't really have a stable life. So they run around and then they live in temporary shelters across wherever they can basically survive and find supports from various different charities, organizations like myself, and many others out there. And we've seen that arise in the last 8 to 10 years. There's a huge spike in general in homelessness, especially in Bristol and other cities. And a large chunk of that are undocumented or vulnerable homeless migrants coming from various different countries that Britain were involved in war or other relations. And because they don't have a safer place, England is for them the most safest place they can find. So they come here to survive and find an opportunity to live and prosper. Most of the people, they are very strong generally, and they want to work hard, and they want to integrate, they want to actually have a life. They don't want to rely on petties and other services. So one thing we have to understand that these people, they are resilient, and that's one of the reasons they survived this long. So having that opportunity, they can actually progress and become part of the economy in the future. But the process itself is so long and so stressful, so difficult, and that's where they make them very, very vulnerable. Let me go quickly check. Okay. So during the pandemic, we actually seen the difficulties. Moslek will agree with me, and we know most of the undocumented or vulnerable migrants, they find work as a cashing jobs in a very, very hard working environments where normally you don't find suitable workers. So many takeaways and restaurants over the years has been supporting those undocumented migrants by doing them, cashing in small jobs here and there, hiring them to stay in a temporary accommodation. And during pandemic, because the restaurants are closed, catering industries are closed, a lot of hardworking, industries is closed. So they were completely cut off from any kind of support, and they've been left and on a more worse situation and more vulnerable situations. And when I say vulnerable, it becomes even worse, because one thing you have to remember, because they're not registered with our GP, many of them have underlying medical conditions that they are not aware of, we are not aware of. So obviously they're very, very high risk to catching an infection. And secondly, because they move around a lot, they don't have a permanent space. So obviously they're a risk to themselves and also risk to other people, because they will spread the infections a lot more faster than generally, when other people are locked down at home. And of course, they have to move around because to find, to survive, to find food, to find support, or make their day-to-day life goes on. So that's two major risks that I can see with the undocumented migrant, and that's one of the reasons this is very, very important and vital. We get them the vaccination done, and I like to thank the current government as well as many other government official councillors who are actually doing quite a lot of work and working very closely with Bristol City Council, Bristol CCG, NHS clinics, and like Rachel said, they are contacting the mosque, they're contacting various different community hubs to do a pop-up clinic, and I have myself involved in a number of them, and there's one happening on Monday in Borderland in Eastern, and we have managed to so far spread the message, so far attracted a number of crowd who in general would be very, very cautious to join. But I think, and Rachel, Moslek, and everybody else, this community engagement is the key on this level of work, because we have a grassroots level of connection with the people. And then when they see a familiar face, when they see a trusted place, they are more likely to come and take vaccination. And then they will continue to keep that conversation for the second dose. And again, continuous assurances from the government that their data are not going to be shared with the immigration, not going to be shared with any enforcement agencies. I think that message we need to continue to give to build that, continue to build that trust. And one thing when I talked about some of the GPs in the last couple of days, they're also very keen, while they come for the vaccination, the other benefit that what they can do is actually get them registered onto the GP. And I think that's very, very key and important. So we are, as a Moslek is volunteering, as well as many other who can, be that superconductor, we call it in the charity term, where they can transfer the information to them in their own language, in their own way, where they can understand the benefit, and then they can get themselves registered. Because once they have it registered, then it's easier for NHS to understand if they have any other medical conditions which need to be flagged up, and they can get a little bit more care from the agency. And the final point people has put me, what challenges do we personally feel they've encountered? So I think 3 challenges I've written down. One is clear messaging, and I think we have been covering that since Natasha told me, clear messaging and very consistent messaging, and access to safe place to get vaccinated. I think we also covered that, Rachel, like Rachel said, having community hub, having the mosque, having somewhere where they feel they're connected, they emotionally feel safer. I think that's definitely a safe place to get vaccinated. I think that's a really, really good approach. We already started to see some benefits of that. And finally, some trusted face, like get the community leaders, get the faith leaders, get the people that actually are working on the root level, grassroots level, to come and help out. And I think, using those kind of 3-4 challenges, overcoming those, we will get there. And I'm working very hard to make sure that we don't stick to 20%. We continue to fight to get it down as as much as we can. Hope that gives you a bit of a snap view of what I'm doing and what I'm involved with. Any questions? Welcome.
Yes, as you heard, Naseem wants more than 20%. So obviously, before we get there, is there any other questions you want to ask Naseem? Come on, get your questions out. Naseem, I think you're let off easily. Yeah. So you still have work to do, I'm afraid, to get more than that 20%, as Rachel said. Okay, so next person we have, who is actually a grassroots activist, as well as works with unregulated or migrants. So I think she will give you another insight from a volunteer sector. So Sunitha, please do put your input to us so we can get a bigger picture to what's actually happening on a grassroots level.
So thank you for having me. I'm Sunitha and I'm from an organisation called Regularise. We're a migrant-founded grassroots collective, and we're made up of migrants, British citizens and allies. And just a bit about us so you have some context. We seek to improve the quality of life of undocumented migrants who have already established lives in the UK by attaining them basic rights and a safer and more equitable path to settlement and citizenship. So we would like the UK government to implement a regularisation scheme similar to the EU settlement scheme for all migrants currently living in the UK without leave to remain or other appropriate documentation, and for all those who have lived in the UK for at least 5 years to be settled permanently. And we focus on solidarity and amplifying the voices and needs of undocumented migrants. And our whole campaign is centred around and informed by those with lived experience. And a few people have kind of alluded to this, but obviously through the work we've done with other organisations, during the pandemic, we have seen that the challenges that undocumented migrants have faced have been exacerbated. And this is obviously from like policies, like issues around like right to work and right to rent, which Naseem mentioned briefly. So our current campaign work has been focused on vaccine access for undocumented migrants. So that's been since about December. And we started that because we were having interactions with people where they were struggling to register with GPs. And we understood that at that time, it was a requirement to be registered with a GP in order to receive the vaccine. And a particular example that we had was someone who was an undocumented man who had struggled for 3 months to register with a GP. On his first encounter, he was told to leave the premises when he mentioned that he was undocumented. And finally, when he was able to register with a GP, he had to do it somewhere, not where he lived, but another location. And unfortunately, this isn't an isolated incident, as other people have mentioned. In some cases, like the Doctors of the World survey, 20% are being turned away. And it's quite demoralising when you go to register with a GP and the first encounter is that. So it's something that definitely needs to be addressed. Anyway, following on from that, we hosted a meeting with Nadeem Zahawi, the Minister for the COVID-19 vaccine deployment. And he gave reassurances and assurances that everyone, irrespective of immigration status, would be vaccinated. So we've been part of campaigns such as Vaccines for All, which involves Migrants Organise and MedAct and Doctors of the World, and the homelessness vaccine campaign, as we kind of value the importance of the intersectional struggles. Some people have mentioned that they have encountered undocumented migrants when they've been vaccinating homelessness populations. So we also understand that these aren't independent issues and intersectional, and also there are parallels between vaccinating these groups of people. So as a result, our collective campaigning, so various groups doing amazing work, the government ran a public information campaign reassuring folks who are undocumented that they are entitled to register with a GP. And it also issued guidance through the Department of Health and Social Care that GP surgeries must not turn anyone away for registering if they don't have proof of identification or proof of address, and immigration status is not a requirement. And we recognise the amazing work that's been done by local councils and clinical commissioning groups to support work with community groups in order to vaccinate inclusion health groups. So Tower Hamlets seems to be doing amazing jobs, but I know Bristol as well, and Newcastle and Gateshead, there's various locations where people are doing amazing work. And including in that inclusion health groups has been hard to reach populations like those who are undocumented migrants and those with insecure status. However, we also recognise that without removing structural barriers that prevent undocumented migrants from accessing healthcare services, and without a pragmatic approach in rebuilding trust with migrant communities, the issue of inequitable access to vaccination is going to continue for these communities, and it is going to hinder public health efforts to increase vaccination uptake. So I think it's important that vaccines are offered to everyone, obviously, and we recognise that undocumented migrants, some of them are vulnerable, some of them are in the priority groups, but maybe have not been identified as being in the priority groups. And unless these groups are vaccinated, we're going to still see issues around deaths and hospitalisation relating to COVID-19. So obviously it's really important that as many people who are undocumented are able to register at GPs. And we do refer people to Doctors of the World when they do have issues, and we know the Safe Surgeries initiative, but that still needs to be implemented broadly and nationally. And yeah, so we know that there is reluctance and fear, because obviously we're dealing with 10 years of exclusionary policies, things around charging practices, and unfortunately undocumented migrants, and we've talked about this here, we ourselves as British citizens don't necessarily know what is the state of who's charged, where you're charged, what access you have to healthcare as an undocumented migrant. So there's a lot of misinformation and confusion about what they are entitled to and what they are able to access. And we've had issues of people who have got pre-existing health conditions who are too scared to come forward to even access healthcare when they are before this pandemic. And during the pandemic, there's been cases such as that of Elvis, someone within the Filipino community who died because they were too scared to access healthcare for fear of their immigration status. And it's not an isolated incident. So we have come up as Regularise with some recommendations. We think it's really important for a complete firewall between the NHS data systems, and that's the whole of the NHS. It's not just the GP surgeries and the Home Office. This is something that's been initiated in other countries such as Sweden and Ireland, but it still hasn't been initiated in this country. We also think work needs to be done to remove the barriers for healthcare for undocumented migrants, not just in the short term of this COVID pandemic. This isn't going to be finished by the end of the year. This is going to be an ongoing issue. We're going to be having to manage this pandemic for the foreseeable future. So we need to allow people who are undocumented to be able to access healthcare without having to worry about all these fears and concerns they have. And additionally, we've spoken about this quite a lot in this call, but we need to do more to instruct staff at GP surgeries that proof of identification, address and immigration status isn't a prerequisite. Some GP surgeries on their website, they still state that those are requirements, and that can be quite misleading if that's the first part of information that you're interacting with. We've spoken about this at length, like public information campaigns are really important, and this needs to come from central government as well as like community groups and councils where possible. And that needs to kind of include as well issues around understanding their rights, understanding issues around data sharing, because that's something that is a big fear that people have and reluctance for accessing healthcare services. And just one more thing, just to finish off. It's a person to person, like I'm not a doctor or anything, but I've had the vaccine and I was reluctant at in the beginning, but I trusted the science and would urge other people to take that up. That's it. If anyone has any questions, you're welcome.
Please throw at Sunitha. Rachel?
Sorry, I'm just going to go. I wanted to say thank you, but I wanted to still wave. I'm sorry, I thought it was until 4. Really nice to meet you all. See you soon.
You too. See you later.
Bye.
Go ahead.
If I could just jump in. I'm Amy. I can't switch my camera on, unfortunately, either. But I just wanted to basically, say thank you to Sunitha for that, and just to kind of back her up a bit, really, as well. I used to be a volunteer at Doctors of the World as a support worker. So my background is I'm a Bengali translator, so I was there in that capacity. It's been about 2 years now since I last went to the centre, and that's partly because of the pandemic. I don't live in London at the moment. But sorry, that's my cat in the background. But I just wanted to say, I think that when we think about people who are accessing these services, so in the case of people that I was working with, people at Doctors of the World who'd actually managed to get to the surgery, often because they were at the stage where they required quite serious intervention. You know, it was a big thing for them often to actually have reached that point to go there. And the kind of, I think it's just really important to mention that that's probably the minority of people who do end up getting access to a service. And just to kind of echo the difficulties that we had there, as a kind of registered and well-known organisation, in getting GPs to listen, and the amount of times often, that I would have to ring up a GP surgery on somebody's behalf as an advocate, just to say, this is this person's right. They don't require proof of address. They don't need a particular immigration status. It was really hard, and that was what a lot of the day was spent doing. And I think it's just so important to spread this message in any capacity that we can, basically. I don't know what things are like there at the moment, but that was my experience, that a lot of time and effort went into that and wasn't always successful. So yes.
Beautifully said, Amy, I must say. Is there any other contributions? Please feel free to do so. Go on, Naseem.
So thank you, Sunitha, for this and sharing that. That's really amazing what you're doing. So just a quick question, and I'm not sure if you covered on that conversation. If we do find some sort of irregularities or something that suggests more right information from whether a clinic, whether a GP or any other government organizations, how do we handle that? What kind of steps can we take as a volunteer and other charities, if there's any?
I think it's, so we have been, when we've had issues with people not being able to register, we have gone to Doctors of the World specifically to get them, because they know they have a list of safer surgeries. They will, at least in the area, be able to flag up maybe a better place for someone to register. In terms of, I think in terms of trying to hold the government or GPs accountable for information that they have on their websites, I think it's really difficult. I think that, as Dr. Nuru Chaudhary said, for some GP surgeries, they just won't accept people because they're full or they have issues around boundaries. But I think this is why it's really important that we have had issues where people have just gone with the NHS advice to a GP and said, look, this is fine, I can register, why are you making this difficult? And then the receptionist has actually said, okay, fine, we'll register you. But on an individual level, I think it is quite difficult for those people to do that. I think as organizations, definitely if that's something that you see and flag up, let us know, because we have contacts with other organizations and we're trying to build some information around GP surgeries in areas where we know there is some gaps where they are definitely not doing enough to support those communities and those who are undocumented. But just definitely maybe as a first port of call is we speak to us or Doctors of the World, because they are doing a lot of work around advocacy. Vaccines for All campaign are doing the same. So we are kind of trying to share that information where we can, and nationally where we can. But it is a lot for each of us to do alone. So yeah, I think if you can get in contact with us, it'd be great, and we can work together and support each other where we can.
That would be amazing. And a quick note on that, while we have that kind of subject on board. My first experience when we did that pop-up clinic, one thing I just want to quickly share. Whoever sits on the reception, I think is very, very important, because as soon as some of the people that registered through me, they came in, and the reception quickly goes, what is your name? What is your address? Where is your postcode? Where is your NHS number? They really get very, very defensive. And some of them start giving their friends and relatives details because they were so scared, they didn't know what to do with it. So I think, and I had to speak to the leading GP and said, we need to make that reception a little bit more welcome and warmer, or get someone, a translator on there, just to direct them, because people see the familiarity face. Otherwise, they feel like they're cornered. At one point, I had somebody actually quickly disappeared into the car park. So, the doctor goes, oh, he's gone, he just left. Because obviously then they go into the booth, and then again, they have to go through the details of postcode, phone number, details, and they ask us questions, have you had this, have you had that? And many of them just like, okay, I don't know what I'm doing, and just keep nodding their head. So I think, that's something that we have learned using our first pop-up clinic. And now I'm trying to put that message across that, we have a lot of volunteers, and, we are grateful in a country like England, where actually, volunteers are so amazing, and every work I do are based around them. So, we really depend on them, and they really make things happen. So just want to quickly point out to anyone out there who probably experienced similar thing. So even though it sounds quite easy, but when it actually goes into a room full of, a very, very doctor who's already stressed enough for various reasons, working long hours, and they do this mobile clinic as a volunteer outside the GP hours, as my understanding, many of them I attended. And so obviously it's a lot of stress on them, so I think, that transition, that conversation, the first point of contact, if we can, tone it down into a more relaxed environment rather than just a process of paperwork, that would definitely help. Just a quick mark. Thank you.
Yeah. I think also, Naseem, something to mention is Doctors of the World do training for receptionists and people in GP surgeries, so that they are able to provide a better level of care, and not, they are the first point of contact for so many people, and that can be alarming when they're getting essentially interrogated with all this information. Even for ordinary British citizens, sometimes receptionists can be a bit difficult to interact with. So it's definitely a valid point. Yeah.
Forgive me.
No, go ahead, Natasha. Absolutely, go ahead.
I was just going to just say what you just said right at the end there, Sunitha, about even as a British-born citizen, I know I'm brown and that, but even as a British-born citizen with a Anglican-sounding name, I find receptionists can be quite frightening, and they are the gatekeepers, aren't they? And like you say, Naseem, they set the tone for the encounter with your healthcare professional. So I was really pleased you said about the training, because that is something I can definitely flag up to my colleagues in primary care, if they're not aware that this training exists for their receptionists. So thanks so much. That's really helpful.
Go ahead, Nurur. Thank you, Natasha.
Sorry, let me unmute myself. I was quite impressed with the work that Sunitha mentioned they've been doing. Very grateful for your work, Sunitha, and appreciate the importance of the work you have been doing. I just wanted to share some ideas very quickly, and then maybe a few suggestions. I am still quite worried about getting undocumented migrants registered with the GP. I didn't still fully understand how long would it take, and what are the practical challenges they are currently facing, especially say if I focus on Tower Hamlets. I know this is a whole country-wise campaign, but say if I focus in my local community, I don't have the confidence that if I make a recommendation to someone that I know from the community, send someone or ask someone to register, I don't know how many months we will take, what's the process, what are the complications. So there is a lot of barriers in that. We would like to get people vaccinated as soon as possible when the vaccines are available. But the process and the complication involved in it, it could be a real barrier. It can can be seen and the most problematic. And then obviously whether receptionists are trained and not, and all other issues around it. So I was thinking that locally, I don't know whether we have volunteers, if we can if we can find GPs that would be welcoming undocumented migrant, if we can get those information somehow, and maybe come up with an idea if GP surgery volunteers to use some kind of signs to say everyone welcome. They don't need to say undocumented migrants are welcome. In some kind of wording, if they put a logo or something, a sign in their website or in the surgery to say everyone, people would understand what it means. That, you know, all where the vacancy, they have vacancy or they have not, or everyone welcome. Then we can refer those people to there. I think I'm very interested to see the practical, practicality of the problem solving. Also, as been mentioned earlier, that would there be an alternative? So I'm still a bit confused that if someone is not registered, can they still go to East London Mosque, you know, those sessions, and then can have the vaccine? So we need to clear about within ourselves. So if it's a mandatory requirement to in order to get vaccinated, do they have to be registered with the GP, or can they just go walk in to a center? And then if this is possible, then why not we go with that route and tell those undocumented migrants that you don't have to be registered. Okay, this is your choice. There's an option. But if you don't want to get registered, then just as a priority, you can go to East London Mosque or wherever there are centers, and you can just go and get vaccinated there. So I think more understanding and clarification is needed in the area for us to actually be effective in it. So effectiveness matters, doesn't it?
Can anyone clarify this? If not, there are a couple of things that I would like to say on this precise issue.
I can only share my experiences in Bristol with the GP tree and various other GPs across it. My conversation meeting with them on Friday was they would have the vaccination center and anyone can go and vaccinate. Obviously, the criteria is priorities are, you know, they have to be undocumented, by certain age, certain, you know, underlying medical condition. But they would have another 2 desks on the side for anyone that would like to register for the GP. And they would actually get a volunteer for certain GPs where they have the capacity to sit there. And as a volunteer for us would be to roll that, you know, if you're not registered, would you like to register? But obviously, like everybody said, the question is, you know, they have to use an address to receive the letter, because obviously NHS does require an address. So what we're doing, we're utilizing the mosque address or a local Bangladesh Association address, get those letters. So it does take a bit of a process, a bit of involved work. But I think we're finding ways to kind of utilize that. And that's happening in Bristol. And we're working really hard to get that down. But obviously, I'm not sure about London and other places. I hope, you know, that thing kind of rolls out throughout the country. So that's my experience so far. And I have to say it's looking a lot more positive than the original idea that I had.
Go ahead, Moslek.
Say to Nuru, by this information about attracting people, I think one of the big things is, first of all, publicly, people are afraid to say that they can, you know, the undocumented migrants should come and get themselves registered. It's not just about COVID, but long term, because if you think about it, these people could have so many different underlying issues that could, you know, could be worse. For even, it could be a virus they could be carrying, you know. So they need that support as much as possible. It's the barrier of them not trusting the system, not trusting many people, and coming forward to register, because registering is a good thing for them in every ways. It provides a first kind of set of documents that they need to say that they've been here or they are here. Because up and now they're ghosts. Nobody knows them. The authorities don't know about them. There's a lot of them who are in this country and have been here for 10, 15, 20 years, even more. Nobody knows about them because they don't have any documentation to prove that they've been here. And even being registered with a doctor, that becomes a proof for them in a certain length of time that they can actually regularize their stay. So it's building that confidence. And I think this is where a lot of community work definitely will be needed. But I think the authorities need to do a bit more. I think the authorities, even though the law is there and it's clearly stated in the government website to say that they can register, it needs to come out a bit more public. I think that's what's missing from that.
Okay, so we're actually coming kind of near to the end, and whereby the issue really is about practicalities. So really, well, in a nutshell, practically speaking, I know we've covered it already. What do you want to see things to happen to make it more concrete? So I'll go around talking to everyone one by one, especially the speakers anyway, and then I'll come back to Amy and Chris to talk about some of the projects that they are and or have done. So then members of the panel can understand a bit more about it. So Natasha, let's start with yourself first. What would you like to see practically happen moving forward in the context of undocumented migrant actions, more like, rather than kind of the words that we've talked about so far?
Okay, so thanks, Ripon. I think my main thing is my specialist area is about information. So I think my thing would be for that people should verify before they amplify. And that goes for the clinical information as well as all this stuff we're learning about, or not learning, but that's coming out into the open about what you're entitled to and what you aren't. So hopefully we can make sure that people are getting clear messages wherever they are in the system.
Perfect. So clear message from the perspective of Natasha. Nurur, obviously, you also have played a part. So what would you like to see, practically speaking? Let's make it more practical and more concrete. I know you talked about it briefly. Now let's summarize the whole thing into a couple of words.
So in terms of action point, my focus would be giving people confidence. That question, unfortunately, hasn't been answered, and I still don't have the answer of that question. If undocumented migrants going to the local GPs and registering themselves. So if someone using a mosque address or address of an association, we need to give these people confidence that the information will not be shared. And then we need to do something about it. So we need kind of a statement from GPs to say that we hereby make this commitment or make this announcement that information will not be shared. So maybe there's some work needs doing to achieve that. And as I said, also, we need to have information about where these people can go. So the two things, okay, vaccine is our priority. So we need strategically make the decisions. If there is a long process or there are complexity around registering, we don't want to waste time in doing this. Vaccine is our priority. So maybe get those people who have vaccinated, but at the same time, remind them that, as Mostek, I think, mentioned, and then Naseem also mentioned that registering is quite important. So not making people think that is not important, but then you prioritize your need. Vaccine is number one priority. If that can be done within 2 weeks, then get it done, or a month. But at the same time, we need to support these people to get registered because they're entitled to register, and they are entitled to have services being offered within GP for free. And then obviously there are other benefits of having them recorded that they are here. And then obviously we are the ones part of this group or supporting and in collaboration. We can all work together to get this done. But I'm still very concerned that we are not giving these people the confidence that your information will not be shared. And that could be a fear factor.
I mean, interestingly enough, Nurur, I spoke to someone from the Home Office yesterday, and that person was meant to attend at this meeting today, but I deliberately avoided him taking part because just by having Home Office's label on a leaflet, that would probably deter a lot of people. That's why do you see?
Makes sense.
But having had a conversation with the representative of the Home Office, he said, we GPs and us, we don't share information. In fact, there was one specific case which is quite a sensitive one, where someone was being abused in an accommodation, and the question is, should that person report the incident to the police, and would the police pass the information to the Home Office? Then the response I received from the representative of the Home Office is that the incident that we're talking about is a criminal matter, i.e. X, Y, and Z. So the police will only share if the person gives consent in order for the police to share. Otherwise, the police won't. And the same rule also goes with GP. They'll only share the information if the individual gives consent. However, on the wider scale of things, there is no relationship between the GP surgery and the Home Office. And from our own professional experience of giving money advice and most importantly, death advice, when an individual in the context of health faces the Home Office, it's when debts were not paid under the NHS, and therefore the NHS will say the following: if you don't pay the money within a certain period of time, we will make sure, we will tell the Home Office. So when you do make an application for naturalization, it has one section which says the following: are you in debt with the NHS, or has there been a county court judgment against you? If there is such judgment, it may impact your naturalization. Is in that context, yes, you do. However, on the wider scale of things, you won't, but feel free to say otherwise. All the things that I've said is pretty much based on my own professional experience. However, enough of me. Is there anything else you want to add?
You're asking me?
Well, actually, before we say anything else, Nuru, there's an email that I've sent of Durga Siva. She focuses in Hackney and Tower Hamlets. I spoke to Durga a few weeks ago, and she focuses around the area that you're mentioning. Now, there are 2 surgeries in East London, especially around Hackney South and Tower Hamlets, where it's designed for individuals who are unauthorized, who can register without any complications whatsoever. To get precise details of where the local locations are, please email Durga and she'll tell you more about the areas where you can register. Just to answer your question.
Yeah, it does. But just one quick question still remain unanswered to me, or maybe I didn't understand. Where we need to see evidence of GP saying that we will not share the information. I think it would be very helpful to see that evidence somewhere in a form of documentation that they have made this commitment that they will be protecting this information. Without having not seen this, I don't see this information, I would have the doubt, and then I wouldn't be able to share this with members in the community.
Sure. Okay, fantastic. Thank you. Now, Naseem, what do you say to that? I know Natasha had her say, Nuru had his say. Your turn. Go ahead.
So we are talking about actions taking on board, and I like to kind of encourage our communities, community leaders across various different sections, especially since Bangladesh COVID, Bangladeshi communities leaders, they've always been in the front line and always been busy taking pictures. It's time for them to come out and help out this transition. It's time. I want to see more community engagement from these people, and I expect they need to play a vital role to get this undocumented, vulnerable migrants getting vaccinated as well as registered, so we can minimize the infection, minimize this pandemic post impact, so we can get on with our life and continue to improve. So, is my request to anyone and everyone involved with any kind of community capacity to come forward, use your connection, use your engagement, and let get this over and bring it down the percentage very, very low. Thank you.
Fantastic, Naseem. Thank you very much. Sunitha.
Yeah, I'd like to echo what Nuru said about we need to build trust. I think we are unfortunately dealing with 10 years of eroded trust for a lot of undocumented migrants. And whilst you said, Ripon, about GP surgeries, we generally know that they don't share information with the Home Office. People don't necessarily see the GP surgeries as a separate entity to like secondary healthcare and hospitals. So I think there's a lot of work that needs to be done. And unfortunately, this isn't going to be over by the end of the year. So yes, it's important for people to get vaccines. And I think the work that community groups are doing is really important. And that like deals with the vaccine issue. But I also think we need to think like a bit more medium to long term, and getting people registered with GPs is a huge priority. So yeah, that's what I would say.
Lovely, thank you. Okay, I mean, just to kind of finish up, actually, Chris, you recently written a report. Chris is from, tell me if I'm wrong, it's LSE, isn't it, Chris? LSE? Or is it King's?
Kings.
Okay, oh God, sorry, I know competitors, sorry.
How dare you?
I know. Well, you've written a report, haven't you, done research on COVID-19 and language issues. So tell us a bit more.
I'll just fill in quickly. I mean, our data isn't on, it doesn't directly relate to undocumented migrants,
Sure.
but it's focusing on the Sylheti-speaking members of the Bangladeshi communities in Tower Hamlets. So we've interviewed older members of those communities who may or may not have different issues accessing information directly. And we've interviewed people who have had the role of information sharers in those communities. And so based on that data set, we're finding out that information sharing is critical to how the community has understood and negotiated the risks related to COVID, and that language, particularly Sylheti's role as an oral language, is vital to that. And I think what people were saying here about trust, that's definitely emerging from our data. Trust is absolutely vital, particularly trust in the messenger. We've seen different axes of trust emerging from our data. One is that more locally based people are more trusted. That's probably quite obvious to most people. But also by locally, we also mean things that are more physical. So videos are more trusted than posters. Door to door is better than a telephone call. And also the other axis of trust is expertise. So health experts are trusted, and all of this stuff about, we have lots of local GPs doing information about vaccine videos. Those are really good. They seem to be really engaged with by community. These public engagement events, I think, about vaccine have been really good as well. But one thing that emerges, and I think the final point I'd just like to make very quickly, is that information sharing is not always positive. It can equally, as we know, be negative. It just takes somebody to get the wrong end of the stick and share the wrong information. And I'd imagine, so the stuff that was being said earlier about training receptionists, I thought it's an excellent idea. Information sharers, we would distinguish in our data the difference between information sharers that happens incidentally and mediation, which is a more strategic approach to linguistically and culturally translating this information in a way that's more persuasive to the people who might not be accessing information directly. And part of that, become a mediator, you might need some training. You might have some linguistic and cultural awareness, but you need to be able to have a critical level of health literacy that enables you to access information in particular ways and decide what is useful or how to repackage those facts in a way that people you want to communicate need to understand it, and it's likely to engender trust. So if you want to know more, I'm happy to fill you in. So just my email's in the chat.
There you go. We should be using these sort of platforms really to network. So that's one of the reasons, really. So feel free to talk amongst yourselves if need be, or send your email to each other on a privately matter. Fair enough. Great. Now, Amy, I know you've got a similar kind of project that you've started, unless you've already finished it. Do you want to briefly talk about it? Are you there still, Amy?
Yeah, definitely. I'd love to talk about it. Thank you, Ripon. It's quite a good opportunity to do so. So yeah, very similar project as far as I understand to what was going on with King's, but we're definitely late with this one. It only started back in December. The good news is that it's going to be ongoing until December of this year. So there's plenty of opportunity for people to get involved. I just want to say that our project is actually covering 14 different languages spoken in London. So if anybody has experience with communities with other languages, there's all sorts of things. I'll just put the link in now into the chat for those different languages. So we're looking really at communities who've been disproportionately affected. As most of us will know, the Bengali speaking community has been severely affected by COVID. The numbers have been very high. And so we're looking at potential reasons for why that may be the case. We're still, well, I only came into the project about a month and a half ago, so I'm still very much at the beginning of the research. But we're looking at all sorts of things, and things are emerging as we go along. So things, for example, like the narratives between what's happening in Bangladesh, the kind of national narrative over there, compared to what's happening here and how that's feeding into information. I'm really interested in the undocumented Bengali speakers in London, how they've been affected and what we can do for them. And also, I think a particular thing, and I just want to say, so I don't know if this has been part of Chris's research as well in terms of what he's found, but I've been an interpreter for the NHS in Reading for a couple of years now. And I have to say that the ways in which I've seen people who don't speak English treated in that capacity have been shocking to me. It's really interesting as an interpreter because often people just forget that you're there, you know, you're kind of the third party, no one really pays any attention. But it's just that kind of personal experience that is really only my experience. I haven't spoken to many people about this. Just has made me question the level of trust that people have if they're going and they're being spoken to in that way. So yeah, I'm really interested in that, and anybody who has any experience of that or knows anyone else who does might also think that's a factor in terms of people seeking advice and the vaccine.
Do you want to put your email address so people can get in touch with you directly?
Sure,
And your project, by the way, feel free to email her if need be, or Chris, feel free to share your wisdom as well. That would be useful. Yeah, there we go. But I must say that, guys, apart from that, I think we've covered quite a lot, actually, I must say. And I'm glad it's not overwhelmingly high in numbers because we can be more personal. And I think we were able to be personal. And I mean, that's going to finish off with. I just want to say thank you to everyone, all the speakers. I think you're all brilliant. You clearly care about the subject a great deal, and it shows. And we've all, in a way, played our part in dealing with the pandemic and protecting the vulnerable communities, either through research or grassroots activism or campaign. And even Natasha's slides were brilliant, by the way, lovely. you definitely busted all the myths, you know, and keep at it. But of course, everything has to come to an end. But feel free to connect in your spare time. But on that note, let me just kind of say thank you, everyone. And thank you also taking part on this platform on behalf of BritBanglaCovid. Apart from that, it's time for us to call it a day.
Thank you.
Yeah?
Thanks, Ripon, and everyone else.
Take care.
Thank you, Ripon.
Thank you for joining us today.
Bye.
Bye.